portfolio, while we also provide treatment to patients from the community. And in a lot of ways, we've based our treatment around the latest science of the care for addiction. But we also realize sometimes that doesn't come through to our patients, and they may not really know all the strategy that's gone in behind the scenes. And so our goal with this seminar series is to try and bring that information to the forefront and really share with patients, their families, the general community, what we know about addiction, what we know about its treatment, and how we as a society can do more to support and facilitate change and recovery in individuals who use substances. This is the fourth of these series we've done. And as I mentioned, this is a new initiative for us. So we're really curious to receive feedback. Are we accomplishing our goals? Are we sharing information that's relevant and useful to you? And is this something we should continue? So please, if you get the chance, there'll be an email in the chat that you'll see, and you can use that to communicate with us back channel and let us know if this is something we should continue, if there are other topics you'd like to know about, and really how we can make this more useful to you and the general community. Okay, well, it's a few minutes after the hour. Let's go ahead and get started. Welcome everyone to today's presentation on the family and addiction, how families and friends can help support a loved one with an addiction. I'm Mark Ilgen. I'm a professor in the Department of Psychiatry and the director of the University of Michigan Addiction Treatment Services, or UMATS. UMATS is located in the Rachel Upjohn building off Plymouth Road here in Ann Arbor, and it's part of the Addiction Center in the Department of Psychiatry. This educational series has been made possible by the Patrick Gibbons Memorial Fund, which honors the memory of Dr. Gibbons, a passionate doctor who helped many people in the pursuit of recovery from addiction. These funds provide addiction education and for those who are in the pursuit of recovery, and fosters patient, family, and community outreach efforts. We at Addiction still appreciate the legacy of Dr. Gibbons, and much of the core work that we do was informed by his thoughtful and caring work in our community and really throughout Michigan. A core part of our mission at UMATS is to deliver care that's directly informed by research. And as I mentioned just in the warm-up, this speaker series is designed to share the latest research on addiction and how it helps explain how problems related to substance use arise, what makes them continue, and how to break out of that cycle of problematic use. We're aiming to deliver this series quarterly and have talks that focus on different topics related to addiction and its treatment. Tonight, we're joined by Dr. Charles Graham. Dr. Graham is a licensed clinical social worker and psychologist. He works as a clinical child-adolescent therapist at UMATS, where he treats youth and their family with co-occurring disorders. Dr. Graham has over 20 years of clinical experience working in private, nonprofit, and governmental settings, where he's provided direct care and supervised other therapists in delivering psychotherapeutic interventions for adults and children from various cultural and racial backgrounds. He received his training in CBT, DBT, motivational interviewing, CBT for trauma, family-focused therapy, a whole array of evidence-based and really cutting-edge approaches for helping individuals with substance use disorder. And much of his training has primarily focused on adolescents and youth with mental illness. Dr. Graham received his PhD in social work and psychology, as well as a master's degree in clinical social work and psychology, both from the University of Michigan. He received his bachelor's degree with honors in social work and psychology from the University of California at Berkeley. Dr. Graham, thank you for joining us. Before we begin, I want to mention that questions can be submitted on the Q&A button at the bottom of the screen. There's an option to submit questions anonymously if that's what you would like to do. After Dr. Graham's discussion, we'll save all the questions to the end and do our best to get through as many questions as possible. It's also worth noting that a recording will be made available and emailed to everyone after this seminar ends. Now, let us begin. Dr. Graham.
Great, thank you, Dr. Elgin. So as we begin today, hello everyone, and thank you for taking out the time to join us in this conversation and discussion on what I think is an extremely important topic. Few topics when addressing the role of addiction in people's lives evokes, I think, more emotional and sensitive material than discussing the ways and means of helping a loved one deal with substance use disorders. Drug addiction is a complex situation and circumstance and has so many dimensions. It can disrupt so many aspects of an individual's life, including those involving relationships with families and friends. Some have said that addiction is not only a personal disease, but a family disease, creating stress and discomfort for all who are involved and connected to the issue. And so it's, I think, it's important to be able to kind of discuss how can one effectively address and help those who are dealing with addiction within family networks and circumstances here. I'm reminded of a wonderful quote and aspiration that was written by Charles Dickens. It's a quote that reads, "Have a heart that never hardens, a temper that never tires, and a touch that never hurts." It's a wonderful aspiration, but also a personal challenge, right? Particularly, I think this is a challenge for many who must deal with sometimes the onerous and difficult interactions that comes with a loved one's struggling with drug addiction issues. How do you keep having a heart that doesn't harden, a temper that doesn't tire, and a touch that doesn't hurt when the perpetual issues around difficulties of people struggling and loved ones struggling with addiction continues to occur? I've spoken a number of times with families and friends who have become so exhausted by the amount of energy being put into at least encouraging, enlightening, forcing individuals to see their problem and to stay in the process of working on their problems. And so what I do hope is that this presentation will be an encouragement to some of you, if not guidance to others, that there is hope and strategies and methods that can prove to be supportive in helping people who are dealing with addictions. Let me begin by saying that if you are a family member or a friend or a significant other to one struggling with addiction, I think it's so important to remind yourself and to continue to remember that you matter and that you're very important and significant to the ultimate well-being and productivity of the loved one in treatment and who is struggling with use disorders. Research shows that family and close supportive others are often the single most important motivating factor and driving force in a person's decision to change and address their substance use problems. And we have known for a long time that treatment does not have to be voluntary to be effective. It is often the urging and the ultimatums of family members and friends that encourages engagement and participation in treatment and plays a major role in the ultimate success in treatment. While treatment outcomes often depend on the extent and nature of a person's substance use problems, it's also important to remember that research shows that family and friends support and involvement in treatment strengthens and extends treatment benefits and increases the odds of long-term recovery for the family member involved. Family and friends play an absolutely major role and positive role in the grand improvement of individuals and loved ones struggling with substance use disorder. And I say that because I think sometimes it's hard to see the effectiveness of one's role when externally it seems that nothing is really helping or changing. Before we discuss some of the strategies of suggesting ways to effectively help loved ones with their addictions, I think it's important to acknowledge that there are many obstacles that prevent families and loved ones from seeking and getting help, especially for those loved ones who are struggling significantly with substance use issues. And these barriers are many and varied in scope, ranging from issues of denial and assumption that things will be okay over time, just leave it alone, not to make anything bigger than what it really is. The fear of being stigmatized or labeled when engaging in treatment. The fear that comes with loss of confidentiality and the fear of being exposed and never being able to kind of redeem that anonymity that was once accessible. The lack of insurance resources and financial resources could also be another barrier that prevents people from either engaging in treatment or encouraging others to become involved in treatment. And a big one is just the lack of energy and time of the family member to invest in the help that sometimes is needed to encourage a person to become involved in treatment. And certainly for many, there's a strong distrust of the system. Those who have been marginalized are not well served from their perspective within systems of care, may cause a reluctance to even encourage people to participate in treatment, let alone directly engage treatment. And additionally, the lack of awareness of community services and resources that may be available, and other cultural reasons and mores that may ultimately prevent people from considering the help opportunities available. I think it's important to acknowledge that barriers do exist, and that sometimes it's not all about one's intent and desire to help a loved one, that sometimes things not in the person's control are things that are not directly related to the individual may be a particular barrier and obstruction to engaging in treatment. And getting a family member into treatment may not be realistic unless these obstacles are first addressed and dealt with. With that said, one way to effectively help a loved one with addiction is not confusing helping with enabling. Helping and enabling are not equal. When thinking a little bit about helping in the context of substance use and addiction treatment, helping is the concept of supporting loved ones in doing something they may be incapable of doing themselves independently, and assisting them in preventing and altering and interrupting the process of addiction. So in some ways, it's twofold, right? Its ability to help or stand in the stead when an individual is incapable or unable to independently complete what needs to be done. But it should also assist in preventing or altering or interrupting the process of addiction. On the other hand, that is not kind of what enabling does. Enabling, on the other hand, involves doing for the person what can and should be done by the person. And what studies have shown is that there are various types of enabling behavior. There is what we call the avoiding and shielding type of enabling behavior. And this is any behavior that by a family member or friend that covers up or prevents the user or the family member from experiencing the full impact of harmful consequences of their drug use. This type of enabling behavior could include cleaning up the family member's mess after an alcohol drug episode so no one would know that something happened, or shielding the person with a substance use problem from a crisis that could send him or her into therapy. Making up excuses to avoid social contact during that person's drinking or drugging period. Then there's what we call attempting to control. And attempting to control is any behavior by a family member that is performed with the intent of taking personal control over the person's use of their drug. Enabling behavior can include trying to buy things that might divert the user from using drugs, like giving them things such as sports equipment and tools and cars, but not really addressing the fact that the person is still connected to the substances of their choice. Screaming or yelling, swearing or crying in an attempt to get a family member to stop drinking or using. Threatening to hurt oneself in an attempt to get a family member to quit. These attempts at controlling the behavior is a form of enabling. Additionally, there are what we call taking over responsibilities types of enabling behavior. And this is when family and friends begin to design to take over the user's personal responsibilities. Like they take over their finances and their household chores or employment. They begin to clean the family member's drug paraphernalia when left out. They may consistently remind the user to eat at all times, staying home from work to take care of the family members' problems that are resulting from drug use, doing the family members' chores, paying all their bills, you know, covering up for financial mishaps resulting from a person's use. And finally, we have rationalizing and accepting. And the rationalizing and accepting are any behaviors by the family member that conveys a rationalization or an acceptance of the user's user's drug use. This can involve believing and communicating that the family member's episode of drug use is an isolated one, not a pattern. Believing or communicating that the use of drugs are safe, that everyone is doing it, that it's okay. Or believing or communicating that the family member or friend's use of drugs increase the person's self-confidence, that it serves a benefit to continue. All of these forms of enabling seek to be in some way destructive in effectively helping individuals to not only take ownership of their use problems, but assist them in becoming stronger and more progressive towards the course of recovery. In sum, helping should empower an individual. It should encourage a level of competency and a level of capacity, while enabling disempowers, and it encourages some sense of dependency. It facilitates personal stagnation and ultimately hinders overall growth and independence. So in sum, one of the big ways to kind of assist in helping individuals who are struggling with their substance use problems is to set boundaries. And this is a common statement and term, but I think it's really important to understand that boundaries are not just simply rules for behaviors, and they're not just simply the process of limit setting. Boundaries are rules of interaction, and they are methods of functioning that gives some level of clarity and structure overall. And so we encourage people to really, when setting certain boundaries, to make for sure that you're considering whether the boundary is not only adequate. And what we mean by adequate is that there is an ability to set it consistently and appropriately in the relationship, and that is sufficient enough to communicate the expectation intended. But the boundary should also not be ambiguous. And what we mean by ambiguous here is that it should be very clear who is enforcing the particular boundary. There should be no uncertainty who is enforcing it or who will follow through if the boundaries are violated. So setting boundaries involve both maintaining sufficient adequacy and reducing the ambiguity of those limits that are communicated. Creating firm and reasonable limits allows for individuals to experience, again, consistency and structure. And these boundaries could come in multiple categories. It can be around your own level of communication, in the area of communication, I should say. So communication will not occur if you're intoxicated, or we will not have a discussion while you will not communicate either via text or phone while you're under the influence, or you will not have a means of communicating if you are intoxicated. Setting a ground rule, no alcohol or drugs in this house. This is a drug-free home. I will not provide financial assistance or give you money that will facilitate use or or access to substance use. These are can be clear, firm, and reasonable limits that, again, not only provides consistency and structure, but will hopefully help to limit the frustration that comes when you follow through with the consequences, and ultimately limits being taken advantage of and manipulated. Additionally, as we all encourage individuals through this whole process, is to always appreciate the notion of how important it is to be patient throughout. Recovery is a journey and should always be expected as such. I mean, we can expect that recovery will happen, and it's always important to have that expectation that recovery will continue. But always be prepared for relapse and understand that relapse is not necessarily a sign of negativity. It's not necessarily a sign of ongoing failure. Relapse can be an opportunity to learn, an opportunity to assess what went wrong in order to ensure that that act and relapse does not occur again. Recovery for many is a journey that includes ups and downs, and it's in many ways like a roller coaster experience. And for many, it takes multiple attempts and multiple years before achieving sustained recovery. But the good news is most people can and do recover. And it is that hope that we hope will encourage your patience, will encourage your willingness to modulate and moderate one's emotions and response, and to be a persistent encourager of the loved one through the processes of recovery and sobriety. Another important piece that has been proven to be very effective in helping individuals not only engage treatment, but to stay and participate and reap the full benefits of treatment, is to provide immediate rewards. As you all know, alcohol and drugs impacts the brain's reward system. And rewards is a prime and ready focus of individuals with addiction. Since alcohol and other drugs impacts the brain reward system, individuals are primed to respond to what feels and is reinforcing and rewarding. So as a result, it's important to incorporate immediate and consistent rewards when healthy decisions are made. Oftentimes, some of the decisions that are made are presumed to be what should be given and what should be done. And it's hard sometimes to acknowledge just how big and positive that particular effort has been on the part of the one who is using and in recovery. But it's real important to praise and validate positive, even small actions. Reinforcement of little actions will ultimately help to shape positive behavior and more long-term commitments to engaging in behavior that supports recovery. One of the things that we do regularly in one of the adolescent young groups adolescent therapy groups that we run for young people dealing with substance use issues is that we applaud every time they announce their sobriety. And that applause occurs for individuals who have some consistent momentum and has been maintaining sobriety for months. And it also includes an applause for those who have managed to maintain sobriety for a day. But regardless of the length of time an individual has maintained sobriety, there is a rare situation in which those people who have been validated and applauded do not respond with a smile on their face and some level of positivity at announcing that the small gains made are being acknowledged and rewarded. So provide immediate rewards and acknowledge even minimal small actions that are supportive in an overall positive transition and change. Another important piece that may be very helpful in effectively helping loved ones is to appreciate the fact that people with substance use disorders are often twice as likely to have a mental health disorder, making their disordered situation by far much more complex. Drug addiction is a disease of the brain that frequently occurs with other mental diseases. And so it's important to look for common signs and symptoms for those things that may not be formally diagnosed or recognized. Things like low mood, persistent agitation and irritability, difficulty with concentration and impulsivity. All of these may be indicative of additional psychological or other psychiatric matters that may be occurring along with the substance use disorder. Some people are by far more willing to get treatment for mental illness than addiction, and that's okay. This may be a bridge to care, and allowing an individual to address a matter of concern first may be the first step in helping them to comprehensively address the other matters of concern in their lives. It is believed, however, that treating both or multiple illnesses simultaneously in an integrated fashion is generally the best treatment option. It's important to know that UMATS specializes in the treatment of co-occurring disorders, and many of the groups are formed to address both psychiatric issues as well as the substance use issues. And this comprehensive approach has been proven to be quite effective in helping those with issues related to comorbidity. Another thing that I would suggest as you pursue your efforts in helping a loved one or friend is to begin first with yourself by making sure that you're educated in multiple areas. Oftentimes, being caught up on the research allows for you to provide informed and correct information if and when a family member or friend inquires about a particular issue related to substance. So it's important to know the update information on the effects of drugs and how they play in the lived experiences of individuals. It's also important, a suggestion might be to enroll in a Narcan course. As many of you know, Narcan is a medicine that rapidly reverses an opiate overdose. And it can be given by anyone who has been trained and can be purchased directly from a pharmacy, sometimes without a prescription from a doctor. And there are other community-based distribution programs that will actually provide Narcan free of charge. But this may be a way of equipping you in your efforts to be effective help in the time of need. Also, learn about risks and other contributing factors that may play a role in addiction. The more you are informed, the more you are able to inform the one in need when such time occurs. And always be ready with this information if and when a loved one is ready to seek help. Another suggestion is to always seek out outside input. Stigma around addiction can often lead to isolation and shame and keep us from being open to the possible information that can be helpful. So always seek professional help at every stage of the process of addiction intervention. At the stage of assessment, at the stage of intervention, at the stage of treatment, all of these stages can be engaged with professional help and support. Isolating from others and hiding only increases the likelihood that more damage will occur later. Additionally, it's good to counter this sort of tendency to hide by seeking outside input through other peer support, community-based programs such as Al-Anon and family groups that are geared to work with family members and friends who are dealing with family members who have addiction issues. Attend, as you are doing at this particular time, educational presentations and classes and conferences on substance use recovery as an effort to remain on top of information that may be needed later. Staying informed, again, can always be helpful ultimately when the opening arrives and the time is set. Also work really hard to stay safe. Sometimes as a result of addiction and its effects, safety issues arise. And if you are concerned for your safety, or you think that your relationship with a loved one may not be healthy, you may consider ending this relationship or providing or getting the help to address the issues that may be impacting the relationship. But keep safety in mind. Additionally, for those who are in homes where individuals are consistently using and may become uncontrollable behaviorally, it may be important to safe-proof your home. Remove drugs and other dangerous items from home and make them less accessible to a person who may, while under the influence, make decisions that are not safe. And always know that you can fall back on calling emergency, 911, and there are other emergency numbers, psychiatric emergency service numbers that can be called when crisis occurs, when situations and immediate assistance is needed. You do not have to remain in a dangerous situation without access to resources that may be supportive in a crisis situation. One of the most important pieces that I have found in working with a number of parents and family members is how lost one can become in an effort to help in addressing one's own self-care, right? That sometimes you lose yourself focusing on others. And so one of the most effective ways and means to help another is making sure that you're taking care of yourself. And this enables you to be able to take care of the loved ones when needed. I was jokingly sharing a situation with a family member, but it was a serious statement as well of how I have seen young people after being in treatment improve, get better, and show consistent progress. And after all of the time that it took to kind of get them to that level of stability, only to see the parents in treatment as a result of this after effects of having not taken care of themselves through the process and then dealing with the lingering situations that occur. And so I was encouraging this family, make sure you take care of yourself in the process so that both you and your family member can enjoy healthy living and a healthy future. So this means maintain healthy routines. Make sure that you're eating health in a healthy manner, that you're engaging in daily exercise or regular exercise, and that you are also monitoring the way that you sleep and that you're getting effective and good sleep. All of these things will play a major role in ensuring that you are strong enough, able enough, and focused enough to provide the assistance needed. Additionally, also make sure that you're doing your level best to regulate your own emotional stability and find a way to emotionally express and regulate. That might be through meditation, that might be through mindfulness exercise, that might be through some sort of relaxation, through prayer or some sort of ritual. But it's so important to find a way to become centered, to become focused, and to reduce the emotional buildup that may ultimately, if not dealt with, um, cause behaviors that will prove to be more hurtful than helpful. I want to address a couple of specific suggestions for those who have children and adolescents, are connected to these individuals. Um, Young people are a unique, um, uh, come to the situation with a unique set of circumstances given their own development. And so it's so important that sometimes the focus is not only on addressing young people in a state of severe crisis. Oftentimes, young people are in a progressive nature towards severity and substance use. So there's still a level of prevention that can be employed before things are at its worst. And so it's so important to continue to be a role model and model those things that are healthy in nature in regards to use and in regards to relationships. And be aware of what you continue to expose young people to in terms of how substances are used and the way they are used. And as stated before, it's so important to continue to provide clear expectations for young people and adolescents. Where there is vagueness and a lack of clarity, gives opportunity for justification and permission to violate. So make and be very clear in a no-use policy for your family. And in addition, discuss the risks and consequences that comes with using substances. And continue to set limits and follow through. Discussing rules in advance are always important, for it allows and removes, or it removes the opportunity for surprise and when an individual is aware of what the expectations are beforehand. It allows the child to build trust. And in the process, you're rewarding those healthy behaviors when compliance is obvious. And a few more additional suggestions when it comes to children and adolescents. Always stay involved in their lives. Listen to them. Don't be reluctant to ask, why are you using? Before you judge the fact that they're using. See the reasons behind and address them if possible. Start conversations with observations. By the way, you look tired. You seem happy, unhappy, frustrated. Get to know who they're interacting with and check with their parents. Check with the parents of these friends and get to know them. It's just real important to be aware of the context and environments that young people are involved in. Oftentimes, by being aware, you can be proactive in preventing individuals from engaging in more unsafe and unhealthy behaviors. And always give the opportunity for the child and adolescent to call if they ever feel unsafe and uneasy. And supporting a well-rounded lifestyle. Make sure that you engage in extracurricular activity. Try to provide them opportunities that will fill their time and minimize idle time. One of the major express reasons for use by young people is boredom. And while that is not always justifiable, sometimes it may be that they're just not involved and engaged enough in activities that the only thing left is to be idle and to entertain other options of engagement. Encourage schoolwork, check in on them, limit their time on screens at home and celebrate their improvements when it happens, and stay connected with their teachers, counselors, and other school administrators to access additional resources if and when needed. And don't forget, always reach out if you can and seek out support for yourself as you give support to others. Another way that can be helpful to those loved ones who are struggling with substance use disorders is medication assistance treatment. And providing the option or references to this option is a very helpful strategy for many people. UMATS offers medication evaluation, consultation, and management for patients whose primary problem is a substance use disorder. UMATS has psychiatrists, addiction medicine specialists, and residents, all who are able to both prescribe both medications for recovery and other psychiatric medications. It's important to note that not all patients or people seeking treatment receive or need medication, but it is the belief that patients and people receiving services through UMATS should have access to all safe and effective tools that could be helpful to them. In addition, Um, UMATS also offers therapy and support and welcomes all people, adolescents through older adults who want to understand or change their use of substances, and may be a great place to refer for individual and group therapy, which currently is being offered both virtually and in person, and most major private insurances and Medicare is accepted. Also, UMass also provides services to family and friends who may be struggling with the substance use of a loved one. And there are individual and group treatment options available for them as well, either through parent groups, family therapeutic and supportive and psychoeducational groups. And loved ones can also be involved in the treatment of those receiving treatment if that person provides consent. The point here is that there is available help and there is support not only for the one dealing with the difficulties of substance use disorder, but for the support network and those who are connected with that individual as well. Finally, be aware that there are also other resources available in community. There is Al-Anon and Alateen, NAMI, as well as other programs and resources available for individuals. So be aware of that, and thank you. I'm going to open here for questions. I didn't realize I was a bit over time here.
Great, thank you, Charles. Well, we've got a number of questions. I really appreciated the presentation, and I'll do my best to get through as many as possible. I think what we'll do, it's about 5 minutes to 8 in Ann Arbor here in East Coast time zone. We'll probably go to about 5 minutes after, just so we can get through a few of these. A lot of the questions relate to talking to a family member where you're concerned about their substance use. So just in general, how do you approach someone to have a conversation about their substance use? And especially, what do you do if they don't seem to recognize the negative impact that that is having on themselves or their family?
So I think it's extremely important to not allow for the immediate initial response of not recognizing a problem to prevent you from making for sure you communicate. And I would suggest that you continue to just provide and offer insight and suggestion to what you're seeing, with the hope that eventually things will connect. And sometimes people just need time to process and hear, but not communicating and not expressing what is going on could also set up a possibility for an individual to not realize and seek the help needed.
And as a follow-up question, one of the questions here is whether an intervention, maybe more of a formal intervention with multiple family members and close friends, is helpful. Is there evidence behind interventions, and does that help to change use?
Say that again, once again, question.
Sorry, I was muted there. When, if ever, is an intervention that involves multiple family members or close friends useful to encouraging the individual to recognize their problem and to seek help?
I think that's an excellent question, and it's a common practice that sometimes having multiple members within a family unit or others to provide various perspectives or confirming a perspective is quite important. And so when a situation may be contested, where it's perceived that it's only the opinion of one person and not others, oftentimes bringing others into the situation only reinforces the legitimacy of the concern being expressed.
And you talked about the importance of remaining positive and rewarding individuals in making change around their substance use. But I think a number of people also worry about enabling, as you pointed out, or maybe not tuning in to instances where the individual is downplaying their use or maybe misleading their family about their extended use. Can you talk a little bit about that balance between trying to be optimistic, rewarding, encouraging, but also maybe having been misled before, maybe multiple times, and the frustration that comes with it, and how you approach that? How would you suggest people?
Great question. Yes. Um, so yeah, it's extremely important to be clear in what you're rewarding and what you're acknowledging, and making sure that in your own delivery of reinforcement, that you're not communicating a reward for something that involves use and that encourages addiction. And it's a tough situation. It's not always easy, especially for children, for parents with their children. How do you reward? What do you give? And after a relapse, but then something happens. I think it's real important, though, that whatever reinforcement you give, you're clear and immediate, and that reward is as close to the particular behavior as possible, so that there's some recognition as this is why you're being rewarded, not for something else, and to be consistent in the consequences as well. So if there's a balance in rewards, there should be also a balance in the consequences and follow through for violations of those things, if that makes sense.
Yeah, it definitely does. And we have a number of the questions just relate to helping a loved one seek help. Do you just have any broad suggestions? We talked a little bit about the maybe more formal intervention, but can you talk a bit more about encouraging help seeking, encouraging someone to get the care they need?
Yeah. So one of the slides, the early slides, was there are multiple barriers that prevents individuals from seeking and engaging in treatment. And sometimes we think that it's only because of our failure in encouraging them that's preventing them from doing it. But there may be multiple other factors that may be contributing to a person's reluctance. Maybe it's the fear of stigma, maybe it's the fear of identity issues related to it. The fear of capacity and ability, the fear of success, failure. And so what I would suggest is that continue to be patient, continue to encourage, maybe involve others who can perhaps provide additional information, but also be open to hearing and listening to the reasons why there is this resistance. Give people an opportunity to express why they say no, so that a yes may be more likely when they're heard.
I know at UMass, we often like to remind patients that our first session is really an intake. It's really just to learn about what's going on. And by coming in for that first session, that someone's just engaging in that process of learning more. They're not committing to any length of treatment or any specific modality. They're just kind of learning more. And sometimes just getting through the door can be helpful to folks.
Yes,
So
yes.
no, that makes sense. There's a question here about AA and the role of AA, and specifically whether the focus on having a higher power and turning to a higher power for help is beneficial. How do you view that as someone who is both a clinician and a researcher, and what role does that play in treatment?
Yeah, so AA and other 12-step programs have shown to be very effective for particular individuals, and that it has been the sustaining factor for especially those who believe that additional assistance and external support is is needed and helpful. We have seen significant sustained sobriety and recovery for those who participate in the program. And I think it's a real positive piece when it fits. And this idea of having an additional higher power or something else outside of one's own capacity has proven to be very effective to certain people who feel in their own way powerless to do things alone. So I think it can be a very positive thing when appropriate and fits the individual's needs.
Great. And can you please comment on the genetic predisposition to addiction? How does this play into some of the advice that you might give, especially in families that, does addiction run in families? And then how does that relate to how we might help family members get into treatment and get help?
Yeah, great question. And was a piece that I didn't include actually in the presentation is sort of the genetic factors that contributes to predisposition to use. And there's plenty of evidence that shows genetic factors and other contributing factors connected to addiction, and that there is a increased odds of having a family member with addiction, that others within the family will also have it. And so I think that's in all of our assessments that we do at UMATS and all discussions that we have, there's always that question on how is addiction fitting into your family? What role has it played? And I just think it's a very not only informative thing to know, but can be kind of instructive in guiding individuals into where to go and to kind of assess their own using behavior and where it may progress if intervention does not occur.
Great. And we have time for maybe one or two more questions. I'm trying to squeeze in as many as I can here. No, this is great. This question points out, you talked about in your presentation the need for structure and clear messages around what is acceptable, what isn't. But they point out that many families have a history of permissiveness that probably dates back to years of use. And how do you break out of that chain or that pattern that people might already be in?
Yeah, so I think that's where having an open, a willingness to be open and receptive to insight and intervention for the family. That's what, as I mentioned earlier, addiction has often been described not only as a personal disease, but it's also a family issue, right? And so I think part of kind of breaking the cycles of family patterns requires sometimes some external intervention and assistance and guidance in some ways. And so we often do that within family therapy, kind of expose some of the patterns and have individuals practice new ways of engagement, showing them ways to enforce better, to be more reliable. And with this, things are eventually habituated and people can change their patterns even if they've been long-term.
And as our final question here, we talked a lot about what might help to get someone into treatment. Can you talk a little bit about maybe a little bit further down the path where someone is new in recovery, and what's the process like of supporting those changes and helping someone transition more into long-term?
Yes, so I think that's a great question too, because a lot of focus is on getting them in, but we don't think a little bit about what happens when they get out. People don't tend to be in treatment, hopefully, for a lifetime, at least formal types of treatment, interventions. So I think that it's really important. We talk a lot about the culture of addiction versus the culture of recovery. And part of transitioning from addiction means also acquiring the values and new lifestyles and patterns of recovery. It's the putting off of one, but also learning how to put on a new way. And so, kind of facilitating family members can do that by introducing them to new styles and of behaving that doesn't involve use. In treatment, we inform individuals of the stages of addiction and allow people to kind of understand what stage they're in and what processes and activities they should be doing at that stage of their progression. And that information is then encouraged is given to encourage them to connect with other supportive, maybe community-based programs. People in college, there's a collegiate recovery program. There's, of course, AA, other 12 steps, smart recovery. So I just think it's real important, broadly speaking, to make sure that the conversation is a progressive one that includes the process in a cumulative fashion and not just an introduction into treatment, but realizing that this is an ongoing lifestyle approach.
Wonderful. Well, thank you. And we'll go ahead and wrap up here. We hope that you all in attendance found this information helpful. We provide a couple of links in the chat, including our resource page, our email address, as well as information about UMass as a clinic. We plan to continue the Mind Matters Addiction series again in the fall. You can also subscribe to the Addiction Center e-newsletter to learn more about upcoming events, news items, and other helpful educational resources. And as I mentioned at the start, we're curious to get feedback, so please feel free to reach out if there's anything you want to communicate to us. Thank you to Dr. Graham for your presentation, and thank you to everyone for attending. Good night.